Hello class, my name is Allie and I did my research on opioid epidemics in AB 474. The opioid bill consists of prevention plans that are meant to regulate the supply of opioids, illegal importation across our border, and the development of new drugs. For starters, there is a certain ratio that drug makers must refrain from when making the opioid prescriptions. Also, Food and Drug Administration enforces doctors to prescribe smaller quantities that offer a supply of 3 to 7 days rather than the original 30 days. This allows doctors to regulate how much opioids a patient is prescribed. Second, opioids are not detected when mailed through to the United States, so the prevention of drug importation is highly enforced at our borders and mailing systems. Lastly, the bill is acting upon the severe gap between medications. This means that there are mild painkiller drugs like ibuprofen, and then it jumps straight right into high-dosage pain relievers like opioids. The opioid bill is making a positive stride towards the opioid epidemic, but there are still many improvements that need to be made. The biggest, most important policy that this bill must address is the need for funding. The signing of the bill has had a good exposure from the government, but it still is not enough. There needs to be a $1.1 billion increase of funding in order to make a difference, according to Stephen Barlas from NCBI. This funding will go towards recovery centers and will provide drugs, devices, therapy, and housing to those who are affected by opioids. The extra funding will also decrease the number of Americans killed by opioid drug overdose. In 2017 alone, 72,000 Americans died, which is more than HIV/AIDS has had in a single year. The state of Nevada has implemented a bill to address this crisis. I retrieved this quote from the Department of Health and Human Services, and it has described the bill by stating, "It simply establishes a standard of care for prescribers so that, if prescribing such medications is clinically indicated, the prescriber and patient have the needed information to move forward with that prescription." The bill strictly monitors the number of prescriptions given to patients to induce the risk of addiction and misuse. The pros that come along with AB 474 is that it offers state programs like the Clark County Medical Society and the Nevada State Medical Association. These help educate practitioners on how to prescribe opioids the new way that the AB 474 requires. There has also been fewer patients requesting and expecting opiate medications. On the other hand, the cons include a tedious way of prescribing opioids to patients. It now involves background checks, examinations, and requires much more evidence to prove that the patient is not addicted to opioids. This carries over into practitioners feeling overwhelmed. It also jeopardizes the doctor-to-patient relationship and has made the access to receive medication a challenge. The stakeholders that are involved in the opioid epidemic include the patients themselves, the law enforcement and government, recovery centers and programs, and most importantly, healthcare providers. I currently am not employed in the healthcare field, but have the desire to go into pharmaceutical sales. The opioid epidemic may have a positive effect on the career because of all the drugs that have not been discovered yet, and will eventually boom as a new alternative for opioids. On the other hand, it may go downhill since opioids and marijuana as well are known for being the top sellers for pharmaceutical sales. Overall, the current signing of the opioid bill has the potential to change America and offer the treatment that opioid victims desperately need. There are doubts about the funding and reaction that will be received from the government. However, the opioid crisis is an urgent worldwide issue that uses medical attention, funding, and resources to overcome the challenges that America is working on today. Thank you for listening to my presentation, and I hope you had a great semester.